right, thank you for staying tuned. As we promised, tonight we'll be talking about COVID-19 vaccine with a consignment expected to get into the country few hours from now. Tonight we're having Dr. Shemuchere, who is a virologist, to sort of look into the aspects of Astrazeneca vaccine and also other vaccines and how it will help the nation in this fight against COVID-19. Welcome, Dr. Muchere.
Thank you so much.
All right, now we start off from the information that has been given by the Ministry of Health. They say 1.02 million doses are expected in the country, and therefore the question has been, is it enough to inoculate the population, or what is the percentage that might be said to be enough to sort of protect the further spread of the virus?
Okay, thank you, Irene. Looking at the COVID-19 disease, it's been a complex disease that captured the global community by surprise, and therefore the scientific community had to move in and come up with solutions as fast as possible.
Sure.
And therefore the 1.02 million vaccine doses being received right now is just part of the bigger consignment, with the initial consignment being 4.1 million vaccine doses. These are expected in the first batch, and these will target high priority groups like the healthcare workers, and the second phase will target the high risk groups, people above 18 years and people below above 50 years who are at high risk, and those that are vulnerable in terms of the diseases that they may have, the comorbidities. So it will not be, it's not enough for the entire population, as we require 60% coverage for us to say that the vaccine will provide good herd immunity to the entire population.
So as it is, when you look into the 4.1 million doses, what is the percentage of the population expected to be covered by this particular vaccine doses?
We're looking at initial coverage of between 5 to 10% between the initial stage. The government, through the Ministry of Health, has requested for 1.4 billion funding for the initial stages. And there may be the reception of the Pfizer vaccine once it's available through the COVAX initiative.
All right. Now, Kenyans have raised concerns concerning the efficacy of Astrazeneca vaccine. We have had different vaccines over different time. We had the polio vaccine, the smallpox vaccine, and these particular vaccines, depending on the research, they have different efficacy. And therefore, the question will be, looking at the AstraZeneca vaccine that the Ministry of Health and the government has chosen for the nation, what is the percentage of efficacy or effectiveness of this particular vaccine?
Well, the vaccine, through the initial studies, showed an efficacy of 62 and an efficacy of 90%. All right. In one cohort, the 90% efficacy cohort, this was the vaccine was given as a half dose and then given as a full dose in the second vaccination, the booster vaccination. And in the 62%, they gave a full dose in 2 doses. So we are looking at an efficacy of between 62 to 90%, where the efficacy is a case control study, where you give a certain group is given the vaccine, and another group is given the placebo, and therefore you're able to control and see whether it is efficacious or not. Now we are moving into the stage of efficiency. That has been done as part of phase 3 trial, but also that will be done as part of the rollout of the vaccine into the Kenyan population. All
right. But now, when you compare AstraZeneca vaccine or the COVID-19 vaccine as compared to other vaccines that we have had, say, the polio vaccine or the smallpox, can we say, as compared to the vaccine, it is one of the best research of our times, or can it be said to be sort of, let me say, average as compared to other vaccines that have been invented here in the world?
One of the main concerns that people have raised is the amount of time that it has taken to come up with the vaccine. Definitely we have better methods of developing the vaccines, better molecular techniques, better analysis techniques, and several consortiums have come up, and the vaccine has to go through all the phase trials for it to be approved for use. So for the AstraZeneca vaccine, it has undergone all the phase trials, and it has received approval both by the EU Commission and also by the FDA in the USA.
All right.
So we believe that the vaccine has undergone all the right checks and balances. And the last phase, which is phase 4, will be to check on its safety over time in the population.
Okay. Now, when we look into the vaccine, the Astrazeneca vaccine, one requires 2 doses, which are given between a period of 8 and 12 weeks, all right? Now, the question has been that looking into the demographics, we have children and the elderly. Are the 2 vaccines enough to boost the immunity of the elderly and the children? Because these are 2 demographics that are quite sensitive as compared to the youth.
The studies that have been done so far and the data that we have indicates that the 2 doses are enough and they do not vary in terms of the age groups, and the data is sufficient.
Right.
Although the data from the Pfizer vaccine may have captured a better population, with the Astrazeneca vaccine covering only about 660 people above the age of 55. So 660 people are still, countries like Germany felt that was a low number. Germany, France, Sweden, but other countries in Europe have approved for its use even in the elderly. And of course, for the studied population, it was shown that there was no variance between the age groups. Right. So we expect that the vaccine will work well for all the groups. However, as a country, we will start off with the health workers, who of course will be part of the age population above 18 years. So we expect that to give us a few indications on how the vaccine works in the population.
All right.
And in terms of its efficacy in our population, we have seen vaccines like the flu vaccine having an efficiency and efficacy as low as 50%, right, but still is able to prevent transmission of the flu in the population and prevent death that may occur due to the flu infection.
All right. Now, there's something that raised concern, and epidemiologists have raised concern that the new strains of coronavirus are sort of affecting the issue of curbing the virus around the world. And when we look into South Africa, Astrazeneca vaccine has not been able, has shown not to be quite efficient when it comes to that particular new strain in South Africa, and they had to stop the immunization of Astrazeneca vaccine. And therefore, the question has been, there was a controversy when the Ministry of Health decided to choose Astrazeneca as compared to Pfizer or Moderna. And therefore, the issue has been looking into a country and the efficacy of Astrazeneca, looking into what happened in South Africa. Are we in a sort of danger, or are we facing a challenge as it is due to the selection of this particular vaccine?
My answer would be no. I would support that by saying that in the South African case, AstraZeneca has shown an efficacy rate of 10%. Okay. That is quite low, looking at the initial 62 and 90% efficacy. And therefore, that necessitates the need for a better vaccine. Yeah. However, in the wake of the impact that the disease has had globally, there is need for us to roll out a vaccine. And the issue of availability, the issue of efficacy now plays. So there is need for a balance between the two. However, it's not just a decision for the Kenyan government. The collaboration consortium is known as COVAX, right, and this has taken into play all the global partners, WHO, UNICEF, Gavi, and these will roll out the 2 vaccines. Most of the Pfizer and the Astrazeneca will be rolled out equally in terms of the countries that are involved.
All right. Yeah. Now, according to what researchers have said and medical experts, is that once you're infected with COVID-19, 6 months in, you'll not be given, once you're infected with COVID-19 virus, 6 months in, you'll not be given the COVID-19 vaccine. And therefore, it has been a question of the issue of scarcity. And Kenyans have raised the question why, if you're infected with COVID-19, you might not be eligible for the COVID-19 vaccine at the moment. What is the explanation for that particular theory or that particular statement from some of the medical experts? Now,
the issue is the issue of availability, and the vaccine doses that we're receiving now is 1.02 million. That is not enough for the population. And the understanding is that the vaccine which is carried by a vaccine, a virus vector, an adenovirus virus vector, which is safe for use in humans and which will not replicate, but will form antibodies. So it enters your body once it's injected intramuscularly, and it is able to produce antibodies against the disease.
Okay.
The same thing happens when you're naturally infected by the disease. So for the 6 months period, you're able to produce antibodies. So it is sort of like a natural vaccination. So that tells the people that have already been infected then kindly give the chance to those that have not encountered the virus for the immune systems to be primed, and then they can know how to react to the virus, thereby protecting these people.
All right. Now we're waiting for the second batch in a few months, say in July. And therefore, today we had the industry players in the Bars and Restaurant Association saying that maybe we should relax some of these measures given that the vaccine is coming into the country. And therefore, as a virologist, when you look at it, when the first batch now sets into the country and we begin the process of immunization, should we relax some of these measures of COVID-19 given that the vaccine is already here in the country?
The answer is a big no. We should not relax any of the measures. We should think of the vaccine like hiring a watchman at your gate, but you still don't pull down your walls, you still don't pull down your CCTVs, you just have that as one of the measures. So we should continue washing our hands, we should continue social distancing, wearing of masks, we should continue all the measures that are in play that are recommended by the Ministry of Health. With time, once we achieve herd immunity, and once more and more people are covered by the vaccine, then we can relax some of these measures. But that should come from sound scientific information and good data that should have been acquired by having the virus rates of infection going low and severity of disease also going low.
All right. So Kenyans have been raising the question then how does this vaccine issue play out? Because some thought that maybe once you have taken the vaccine, therefore you spreading the virus from one person to the other is limited, and therefore if we have a certain population in the nation who have been, if we have maybe this first, second, and third batch, you know, being given the COVID-19 vaccine, therefore we should see some of these measures now being relaxed. So does it mean now that the new normal will stay for a long time even if we have the vaccine here in the country?
Yeah, with the new, the introduction of the vaccine, the new normal still remains. Of course, we'll see a better protection of our healthcare workers. Okay. We've seen quite a number lose their lives. Kenya has lost so far about 1,856 people have died from the disease, with over 105,000 infected. Yeah. So we're looking at lower death rates that the vaccine could provide for the country. But now we still cannot relax the measures as it is. We need more data that can enhance our choice of either relaxing the measures or at least improving on some of the measures. Okay.
Now, there has been the issue of testing, and you have seen maybe the health ministry through the health cabinet secretary Mutahi Kagwe saying they are facing an issue in terms of testing the samples due to lack of the reagents. When you look at it, now that the vaccines will be here in the country, does it mean now that we sort of relax, you know, the efficiency in terms of testing or the routine in terms of testing now that the COVID-19 vaccine is here? Or now should we continue testing even as we are continuing to give the COVID-19 vaccines to Kenyans?
The ideal situation would be that we enhance actually the testing and have more people tested, especially before they receive the vaccine. The Ministry of Health and the Ministry of ICT have developed the software that will be able to capture the data of all the people that will take part in the vaccination study. And therefore we expect that these data will provide more information in terms of were these people infected, are they infected in the course of the vaccination, and once they receive the booster vaccine, that is in 12 weeks time, between 8 and 12 weeks time, then what is the effect? Did they get infected? And how severe was their disease? So testing will still remain crucial and should be the ideal position. We should actually test more and more people as we roll out the vaccine in the 47 counties.
All right. Now, when we look into the issue of COVID-19 here in the country, it has shown, that the poor and the rich are not really protected when it comes to the virus. It does not choose the poor, it does not choose the rich. But now when it comes to the issue of COVID-19 vaccines, questions have been raised whether the poor really will receive these particular jabs, knowing our healthcare system and looking at the way we had the issue of cancer tenders and how the Ministry of Health really looked into the issue of protecting the nation when it comes to combating COVID-19 virus. And now here we are staring into a vaccine and the doses are not enough. Are we seeing maybe corruption taking center stage, given that the doses are not enough, and maybe the private healthcare system might be forced to take center stage due to the issue of budgetary constraints?
The ideal situation should be that the government should have in place the system to ensure that it is equitably distributed. One initial indication from the ministry is that the first rollout will be to the healthcare providers.
Yeah.
And these will not be in terms of their caliber, it just be to all the 47 counties, to the level 6 hospitals, level 5 hospitals, coming down to the level 4 hospitals, and targeting all healthcare workers. And therefore, once we move to the second and third phase, and with that good database, then we should be able to know who has been vaccinated. And this should not be in terms of the economic status of the individual, or whether they are rich or poor, whether they are black or white. It should just cover all Kenyans. Yeah.
All right. Now, there has been a stereotype, sort of, and Kenyans sometimes being pessimist, although that happens when it is a new thing and people are not really aware of what is happening. And some Kenyans have been saying that they will not take the COVID-19 jab, given that one is not mandatory, two, some really don't, believe that coronavirus is here in the country. And therefore, what do you think maybe the Ministry of Health has not done quite well in terms of giving information concerning the COVID-19 vaccine, given that the first batch is coming into the country and Kenyans are still not really optimistic concerning the vaccine itself? Some say that, it affects fertility, which is a big issue here in Africa.
So far, studies done on the safety of the vaccine, there has been no indication on its effect on fertility. And one of the things that will be key as we move forward is the information. There's the requirement of information to the general public, breakdown of the scientific information that we have into the common Mwananchi's language, so that the common man may be able to understand what kind of virus is this, what kind of vaccine do we have, how will it affect me, why should I take it? And you have seen this even with the HPV vaccine for the teenage girls. It's already rolled out, but we are seeing very low levels of take-up. And that could be just because of misinformation. And therefore, the ministry needs to up its game and provide more information to Kenyans through social media, through all available platforms, through barazas and all kinds of gatherings where they're able to share the information.
Right.
In addition to that, there is the need to involve more stakeholders, involve all communities, community leaders, involve affiliated religious groups, and therefore everyone will be on board in terms of the vaccine. I look at the vaccine like the new BBI. So people are either taking it or not taking it without any information.
Yeah.
So there's need for people to make the judgment on whether to take the vaccine, not because of some hearsay, but just from sound scientific data and information.
All right. Dr. Mutori, we're talking about 62% efficacy when it comes to Astrazeneca. What does it, can you break down the information of 62%? Because Kenyans will say, okay, 62%, what does it portend? How can you break down the efficacy of this particular vaccine in terms of a day-to-day routine?
One thing when you look at the vaccine efficacy, we look at the prevention. Okay. Is a vaccine able to prevent disease in an individual? For COVID-19, we're also looking at disease severity. Is the vaccine able to prevent disease severity, which is crucial in terms of survival, in terms of the individual healing from the virus infection? and also efficacy in terms of prevention of transmission of the virus in the community. So at 62%, we are looking at a rate where there will be less and less people infected in the population.
Okay.
So out of 10 people, 6 people will be protected from disease, severe disease,
okay.
and 6 people will be protected from transmitting to other people.
Okay.
So looking at our positivity rate of 9%, we are looking at the vaccine taking this to very low levels of even 1% or no transmission at all. However, you need more testing to confirm that we have 9% community transmission, as it could be higher because of the number of samples that you're able to test per day. So therefore, we need to add more in terms of the testing, and more so once the vaccine is rolled out to the general population.
All right.
Yeah.
Now, when you look into our neighbors here down there in Tanzania, given that, of course, as Kenyans, we are taking the vaccine, our neighbors in Uganda still, they will be taking the vaccine. Now, does it mean that our relation with Tanzania will affect the herd immunity or how the efficacy of the virus itself, even if they are not taking the precautionary measures, including the vaccine, in terms of fighting coronavirus?
There are measures set by the Ministry of Health in terms of protection of Kenya and Kenyans as a country and Kenyans as the population. And these measures should continue in terms of testing, in terms of how truck drivers transit between the two countries, in terms of getting the certificate, and probably should see an additional certificate coming from the vaccination. Of course, 2 of the cases of the new South African strain detected in the UK were from people who had traveled from Tanzania. Tanzanian nationals who had gone to South Africa, came to Tanzania and went to the UK. So therefore, this shows that there is the transmission of the new strain, the South African strain, even in the Tanzanian population.
Sure.
And therefore, there is need for us even to enhance our research and our monitoring of the vaccine strains, even in our own country. Therefore, we can know not just who's positive, not just saying 9% positivity rate, but saying what strain do these people have, and how are the strains distributed per county? Why are we seeing certain higher death rates in certain counties than others? And then that could provide the right information.
All right. Now, lastly, as we wind up, unfortunately, politics have taken center stage when it comes to the issue of COVID-19 vaccine, not only here in the country, but globally. We have seen different giants, they call them country giants, or the big 5, some call them. They have been able to do their own research and create their own vaccines. And therefore, the World Health Organization have said that some countries are holding the vaccines due to the issue of diplomatic ties. We have had some say that China, who are having the Sinopharm vaccine, might try to use the vaccine as a leverage to African countries due to the issue that we as a population, we as a continent are not quite prepared in terms of doing our own research and getting our own vaccine. Are we foreseeing a situation now that this vaccine might be a leverage to put some of the African countries, quote unquote, into bondage?
We hope not. We hope that the soberness that has been maintained by the COVAX initiative that has involved the WHO, Gavi, UNICEF will continue, and more vaccines will be added to the COVAX platform, including the Russian vaccine and including the Chinese vaccine. And we do hope that in view of that, then the distribution will be equal. Countries like Australia are doing more than 4 types of vaccines and giving them to different populations. And we are waiting as a scientific community to see how that will play out because of the issue of availability. Therefore, we do hope that the issue of using the vaccine for leverage will not arise, and that WHO would take charge, and more so even the UN Security Council will take charge. As we have seen, this has been a global issue, and therefore it is not just an issue of China versus Africa or other developing countries, or the US versus Russia. It's a global issue, and we should have it sorted out globally. And therefore, this initiative involving COVAX has come in, and this is the first vaccine to be rolled out globally with a one alliance that is giving the vaccine in terms of the population per country.
All right. Yeah. But now when we see, as we wind up, when we see countries like Israel having a 75% percentage when it comes to giving out of the vaccines, and here in Africa we are seeing some countries have not yet received the vaccine, should it be a concern to the World Health Organization to look into how we are having, you know, an equal percent to developing countries here in Africa so that we don't lag behind and even destroy or lag behind the efforts of fighting coronavirus here in the world?
One key aspect in terms of the fight against COVID-19 has been the aspect of population. Countries like Israel have achieved high levels of vaccination due to the nature of their population, well documentation of their citizens. As we saw, that was one of the initiatives that our government had started in terms of the Huduma numbers. And we do hope that more countries will adapt better systems in terms of even ICT systems. And the vaccine will be distributed in terms of the populations. So every country receiving a certain percentage geared towards getting the 60% herd immunity. So there should be 60% of the population vaccinated. With the Kenyan initiative, we are looking at 45% of the population to be vaccinated by 2023, with the government using between 1.4 billion for the first phase, which starts from June to July 2022. And by the end of the entire phase, we are looking at 34 billion by June 2023. So there is also the issue of cost. However, the global community has shown the responsibility and has shown the mandate to be able to distribute the vials of the vaccine doses equally, not in terms of the country's GDP.
All right. Thank you so much, Dr. Mutweri, of course, for giving us a perspective concerning the issue of Astrazeneca vaccine and different vaccines across the country and how we are combating the virus here.